بسم الله الرحمن الرحيم والصلاة والسلام على نبينا محمد وعلى آله وصحبه أجمعين. Thank you very much for the invitation. I'm glad and delighted to be with you here today to contribute to the presentation on a very hot topic, which is the use of AI, or particularly the generative AI, large language models, into the healthcare sector. So my presentation is entitled, Will AI or is AI replacing doctors? And we're going to discuss the evolution of artificial intelligence and the different fields where AI has emerged in the healthcare sector, providing substantial services, either for doctors, for hospitals, or for patients. So let's get started by the strategic health sector objective of Saudi Arabia. So the kingdom is investing a lot. The healthcare sector has a particular importance in the strategic objectives by trying to provide better health, better care, and better healthcare sustainability in the kingdom by enhancing the public health through strengthening, for example, preventive care, and try to mitigate the impact of chronic disease and improving the lifestyle. Also, the kingdom is expanding the infrastructure by building more hospitals. So recently, 260 billion Saudi riyal were invested in building new hospitals here in the kingdom to ensure equal access across the regions. Also developing the healthcare workforce by building and training skilled medical professionals through targeted education and training programs. So now the question, how AI would help achieve these healthcare objectives. So AI actually is not something new in the healthcare sector. It's something that has been proposed since several years ago because AI was used to predict health risks, for example, and suggest early interventions. But what is changing now is the technology is becoming more and more mature. We have more powerful intelligent machines that are able to provide more accurate services and results. Although through providing virtual assistance, for example, in the context of diet and exercise planning, the AI is able also to, in diagnosis, to detect chronic disease. Like I remember at the time of COVID-19, several researchers were working on the diagnosis of COVID-19 through X-rays and CT scans using advanced computer vision techniques for image classification. And now the current trend is also to use AI chatbots. The current chatbots that we see today, and I will show you some examples, are completely different from the old technology, which is based on very simple tree decision making. I think most of you have already had this kind of boring chatbots on WhatsApp where you have only a few choices. You cannot ask natural question. You cannot talk to the chatbot. It provides you some options. It's like navigating into an app bar or something similar. But now the chatbots, they are able to understand almost everything. They can understand any dialect. They can understand any language. You can talk to them naturally. And this actually provides an excellent opportunity to provide ubiquitous access to healthcare services to multiple persons. So the AI also can help in training, simulation for doctors, reduce paperwork, and there are a lot of business around this to how to reduce paperwork, streamline the healthcare transaction processes, and letting doctors focus more on care rather than on documentation or paperwork. So among AI now, generative AI is the trending, and maybe the boom started with the release of ChatGPT back in November 2022. And these large language models, they have huge capabilities that they are able to do almost everything related to text-based processing or image-based processing. And this has helped to improve the efficiency of administrative tasks, like, for example, automating the billing, the claim processing, and the scheduling appointments for patients. It helped also improve the clinical documentation by providing much accurate documentation, much faster. It can generate treatment plans. It can generate patient education materials. It can provide recommendation for diagnosis. It can even improve existing doctor notes. And this has made a big transformation in the healthcare sector. So let me start. There are so many use cases, but I try to aggregate 2 or 3 use cases just to provide you a glimpse or on the use of generative AI in the healthcare sector. I'm going to start by how AI is used to improve the clinical documentation and also how we can use ambient listening to create automated documentation out of a conversation between a doctor and the patient. The features are real-time listening, so the AI system can capture the patient and provider or doctor interaction automatically. It can write clinical notes. It can generate automatic diagnosis that can help and speed up the writing of documentation upon a consultation. And it saves a lot of time. So I can show you one example. This is one example that we have developed with our industrial partners, which is like we can have a device that records a conversation between a doctor and the patient. So you open the conversation, we can have a real-time transcription, which means converting the speech into a text instantly. And of course, when we make speech to text, there are always a lot of errors. If some people already did speech to text, we can have, but now with the use of generative AI, we are able to reconstruct the original transcript, even if the speech to text has huge errors. We are able to recover the original one. Okay, and after that, we are able to make AI clinical insights. I'm going to show you the big picture, showing this figure here, and extract the vital signs, can integrate the data into the HIS systems. The AI can also recommend treatment plans, medication, and this is secure and efficient. Let me show you here clear this application. So we can start recording conversation between a doctor and the patient, and here we transcribe the speech, and finally we are able to extract the slices of speeches related to the doctor and to the patient, because now the whole speech is going to be like one sequence. But with AI, we are able to decode what the doctor has said and what the doctor has and what the patient has said. And after this, we can have a clinical assessment report. This is automatically generated. Look, for example, here it's going to look at the conversation here. It detects كم درجة الحرارة, what is your temperature? It's 38. And now we can find automatically in a structured report the temperature is 38. Any other vital sign that is not part of the discussion, it's going to be here unavailable. There is also information about the blood pressure that was okay. تحتاج إلى ما ضغط الدم لديك 120 على 95. So it was detected, put in a structured way. It's quite impressive. And here it said, I'm going to give you paracetamol. Now we can find the current medication, paracetamol, and writing clinical notes, primary complaints. And so the nicest thing is that it's able even to know the ICD-10 codes and even the CPT code related to diagnosis and procedures. So this is quite impressive. Just by a natural conversation between the doctor and the patient, we are able to extract all this information instantly. Another service that also we work with our industrial partner is helping doctor to generate doctor notes. So here we provide a recommendation system, and after the doctor has written, for example, certain number of words, and taking into account the patient history and the clinical condition, we can generate, this is an automatically generated AI doctor note. So we can save a lot of time for the doctor, sometimes, especially for the first consultation, the doctor can spend maybe 10 minutes, 15 minutes writing a complete notes like this. Now we can make automated, and the doctor he can choose whether to accept this recommendation. He can try to write on his own word additional information, and based on this additional information, we can generate very accurate documentation for the doctor note. So these are some experiments we do now. We have also our some partners who work in the automating the approval of insurance claims. we know that many hospitals, they suffer from high rejection. Sometimes there are missing information in the doctor note. Sometimes there are require more clarification for the diagnosis, for the treatment plan, for the procedure. So what we do, we take the doctor note, we take the patient history and several parameters, and we use the AI to review the doctor note, identify the gaps. So for example, if you look here, we can find what is in red here. There are some inconsistencies that are detected. So we can detect them in advance, and then we can improve the writing of the doctor note to be compliant with the insurance. And finally, we can also generate the claim that has to be sent to the insurance. So this actually can be easily done with artificial intelligence with large language models. Another use case is to use AI from neurolog and psychotherapy. And this particular sector is very critical because sometimes they deal with people with special conditions, special constraints. Sometimes these people don't want to explain themselves because of social issues, because of money. So artificial intelligence here has solved a lot of these problems. It has been proven to be very accurate in analyzing mental health problems, okay, through virtual support with AI chatbots, real-time tracking, and also early detection. So one excellent and very recent research from 2025 is the use of large language model was proven to surpass human expert in predicting neuroscience results. And the authors here have proposed the brain bench, which is a test designed to test how well AI and human expert predict neuroscience findings. So they have considered 5 key research areas: behavioral, systems, disease, cellular development. And the research task is about compare 2 research abstract versions and identify the correct scientific results. And the decision process is based on human. They will read the both version and select the correct one based on their knowledge and confidence. And same thing for the LLM, it will use a metric called perplexity and choose a version that aligns better with the previous research pattern. So the key finding here is that they demonstrated that AI has consistently outperformed the human experts. So we can see, for example, here, there are different large language models with accuracies, and we can see the human level expert is it's at an average that is below the different type of large language model. This is human expert evaluation in terms of accuracy, and this is the variation among different other language models that were trained on neuroscience topics. And they discovered that compact model like Llama 7B also performed well as compared to large models. And this is an excellent study that shows the capabilities of artificial intelligence in providing mental health services in neuroscience field. Another also good contribution is the child counselor. And the purpose here is there is an LLM-based chatbot specialized in psychological counseling. This is one of the critical issues that psychotherapy doctors suffer from, because some of the patients they are shy to express themselves about their personal conditions, and they feel more comfortable to talk to a machine, okay, because of the social constraints, social issues, and so on. And here they have these researchers, they have trained this chatbot on authentic counseling conversations. So they have collected 260 counseling sessions, and they have fine-tuned ChatGPT model to act as a psychological counseling agent. And they employ advanced therapeutic techniques, and the impact is that it was able to bridge the gap between AI and mental health services. The AI was able to learn how to respond to a patient in the same way as doctors. So this is their methodology. They collected data, they processed with GPT-4, and then they fine-tuned the model. Fine-tune the model, it means they will train the model to mimic, okay, it's Vicuna 7B, using 8,000 dialogues among different sectors to be able to respond correctly to the query of the patients. And these are the main findings. Chat counselor was proven to be more specialized mental health. It was proven to be much better than non-trained AI models. Okay, it's almost as good as ChatGPT. Of course, here because they have trained a small model with only 7 billion parameters, whereas ChatGPT 4, it's 1.7 trillion parameters, much more expensive and difficult to deploy. So AI in mental health, there are many endeavors like using integrated devices for real-time monitoring of patients, continuous monitoring, and providing personalized care. Okay, so to conclude, also AI was used in the diagnosis and personalized medicine for early detection, for providing personalized plans and large-scale analysis. So one of our work when ChatGPT was released, we have used it to, we use here a simple classification algorithm for medical imaging. And then we use ChatGPT along with output of this medical image and the patient history, and we are able to generate automatic reports. Okay, so these are examples of automatic reports that are generated, and they were validated by doctors. So from a picture like this and the patient history, the large language model is able to generate automatically an accurate report providing all the different details. And this work was also done in collaboration with hospital doctors. Another thing is also to use AI in clinical trials and drug discovery. That's another topic, but now with large language model, it has improved a lot. The drug discovery process we can use large databases to train LLMs. This will save cost because, of course, hospital doctors know that this process is very tedious. It requires a lot of clinical trials, validations, certifications, and other requirements. And one nice paper recently proposed, 2005, this was like last month, is that they discovered that hallucination of large language model, they can improve the drug discovery. And the idea here, okay, yeah, the hallucination can improve the drug discovery. The new idea is that AI generates unexpected molecular insights beyond traditional perspective that even expert would not think about it. And this reveals potential molecule uses previously overlooked by the scientists. So this is maybe one of the first papers that I have seen that hallucination would have a positive impact on certain fields. So they have to find better pattern recognition, and they are able to enhance the learning from data. So this is the paper if you are interested to dig more into the details. And the idea here is that step one is that AI describes a molecule. The AI will get a molecule code and turns it into word, and sometimes add extra details that are not 100% correct. And the second step is that AI will predict if it fights HIV, for example. If AI reads from its own description, it answers yes or no, and the added detail help AI to make better guesses. Of course, there are still challenges on the use of artificial intelligence in healthcare, including data privacy, cybersecurity attacks. This is why everybody is motivated about AI, but you know the integration is still slower than the pace of the discoveries in the AI integration with the healthcare.
Excuse me, bro.
Yes,
only 1 minute remaining. Yeah.
Okay, yeah, I finished my presentation. This is just concluding slides. So the challenges in healthcare AI implementation, there is a risk of data bias. But now with the evolution of large language models, this is actually less problematic. But the most important handicaps is that the regulatory gaps, because now using language model like ChatGPT, many people care about data privacy, data security, data breaches, and so on. But with the evolution of open source LLM models, it's possible now to have a fully deployed, a fully local deployed solution on premises without having to go for third-party requests. So overcoming the AI implementation hurdles, ensure AI training data represent all population to reduce the bias. The scale of the data is really important. Okay, there is also a need to collaborate with regulatory collaboration, not to have any issues, and also provide education program. The best thing to reduce the gap between professionals and AI is to train them to understand this technology, how it works. They must know about their limitations. Otherwise, it's going to be always reluctance about the adoption. Okay, so thank you very much. It was a pleasure giving you this presentation. I'll be happy to hear from you if you have any questions.
Thank you very much, Prof.